Good afternoon.
Good afternoon.
How are you, Dr. Tatiana? Thank you for joining us today.
Thank you. I'm good, thank you.
Good afternoon to our attendees. I can see the numbers are popping up now. Good afternoon. Thank you for joining. We are live on Facebook, and we are delighted to have our attendees join us today. It's nice to see men and women. Very interesting. Dr. Tatiana, October is a very special month. It is the breast cancer awareness month. And I believe that everybody around the world, whether it's organizations, companies, hospitals, clinics, individuals, are all trying to create and raise more awareness around the topic matter. And it's quite interesting to see that over the last couple of years, men also have been involved in the awareness process. On behalf of the Dubai Businesswomen Council, I want to thank you for actually contributing your time. I know how busy you are, and I know how demanding your job is, but you've actually made some time to be part of the awareness journey. So we want to thank you for that. I'm sure whatever you're going to bring to the table today and all the points of discussion will definitely shed some light in clearing out certain myths and misconceptions around the topic matter, which I think is crucial and very important. So I want to thank you again. I believe we've shared some background information about yourself and your professional journey, as well as the prestigious organization that you represent, Clemenceau Medical Center Hospital. Basically today's webinar, for those who just joined us, welcome, good afternoon. Dr. Tatiana and I are happy that you've tuned in. Today's webinar is Fasten Your Pink Ribbons and Bust the Myths. And I kind of like it. It has more of a positive twist to it rather than doom and gloom topic around a subject matter that is extremely serious. So Dr. Tatiana Khouri is a breast imaging consultant at Clemenceau Medical Center here in Dubai. We're delighted to have her as our speaker and facilitator for today's session. She is going to be focusing on breast cancer myths and facts, and she's going to be discussing some of the signs, symptoms, as well as shedding the light on the risks and prevention methods for that disease. We will find out the truth behind the common misconceptions of the topic matter, and I am very happy to see that there are some men with us in the audience today. So we're almost 5 minutes into the actual webinar. I know Dr. Khouri is busy running a very hectic schedule. So without further ado, Dr. Tatiana, the floor is yours. And once again, thank you for being a part of this.
Thank you, Nadine, for this wonderful introduction. And to be honest with you, during our busy schedule, part of our work as doctors is just to spread awareness. And the talk that I have with my patients usually sometimes take more time than the actual exam or the actual study that is going on, because once you educate your patients, they become empowered and they will help you with this journey. And the relationship between a doctor and a patient is really important. And I cannot stress the importance of patient being aware, knowledgeable, and empowered. So saying that, I would like to welcome everyone who has joined us, women and men, because men are also involved, not as much as women. I know this month is like all pink and women are in the light. But we'll see through our discussion how men are also
And Dr. Tatiana, I think you're breaking up a little bit. I think we've lost you.
Okay, how about now?
You're back. Excellent. I just want to say one thing before you start with the presentation. For those who are attending, this will be recorded And please feel free to share the recording with members of your family, colleagues, friends, and even your own organization. It is, at the end of the day, a very important awareness information. And as Dr. Tatiana mentioned, it is very crucial that we make sure we set the record straight and we avoid all the misconceptions around the topic matter and involve everyone around, men and women, when it comes to creating awareness. So please do feel free to share the presentation later on and spread the message across. Now it's all yours, Dr. Tatiana.
Okay, Nadine, just let me know if the connection is unstable so that I can repeat myself, okay? Thank you. As Nadine said, during this month, it's Breast Cancer Awareness Month. We just want everyone to be aware of this disease, but at the same time, it's not a gloomy picture that we want to put in everyone's back of the mind. I just want everyone to know that we are trying to be positive here. We are trying to see the positive side of breast cancer in case we have breast cancer, to just catch it as early as possible, so that women who are in their peak years, women in their late 30s, women in their early 40s, these are the majority, like the 50% of the population. We are, as women, I'm saying, and I'm surely including the man in this lecture, but since this cancer is more common in women, I just want them to let them know that she is not alone if she is feeling something and she is worried, especially that this is also the mental awareness month. You cannot imagine the impact breast cancer or the anxiety from coming to get just coming and get checked women go through. So I would like also to include the mental awareness month this month in our awareness campaign, because psychologically it impacts us a lot. And as women who are working mothers, who are leaders in their work, it's important to be psychologically at a good state so that we can continue the daily struggles that we have. So I'm going to go over this lecture. As Nadine said, it should be radiating positivity. It's time to bust the myth and the misconceptions we know about all the breast cancer and everything related to breast disease, so that we can be knowledgeable. Once the patient is knowledgeable, once the patient is aware, then they become empowered, and it's easier to have a patient-doctor relationship with them. This is an outline of the presentation. Basically, I'm going to give a quick overview about breast cancer and what is breast cancer. Then we're going to be tackling the signs and symptoms of breast cancer, which is something that we should all be aware of, so that if anything we feel is abnormal, to just get checked. What are the risks and prevention of this disease? We're going to go over some of the common myths and misconceptions of breast cancer. Then we're going to talk about what are the modalities we use for early detection. And I emphasize on the word early detection and diagnosis, so that the treatment is easy. And then we're going to end with a take-home message and, of course, a lot of positivity. So breast cancer, the word cancer alone is just terrifying. You cannot imagine, like, some women don't even like to say the word cancer. I just want to let you know that cancer, we are defeating cancer. We are reaching a stage where we're creating a new targeted therapy for cancer, and cancer is becoming one of the diseases that we're really trying to control. And I hope in the next 10 years, it's going to be one of these diseases that is completely eradicated, just like a lot of diseases that we know about. It's just going to be like the flu, maybe. I really hope we get to this stage. But what is breast cancer so that it's so scary? It's just because the cells that are in our body, they just go out of control. Literally, they go crazy, and they do not follow the commands of our body, the normal commands. So they are behaving separately, and now these cells are growing in an uncontrollable way, and they reach a stage where they create a mass. And these cells that are uncontrollable, they don't stay in the breast. They just migrate all throughout the body. And this is the stage that we do not want to reach. And the cancer cells, the kind of cancer, breast cancer, depends on which cells in the breast they turn into cancer. So this is a nice diagram of the breast where it shows the components of the breast. So it's important to know the anatomy of your breast, just so that you can know the disease and know, more importantly, the details of the disease. So as you can see here, basically the breast is made of 3 main parts. The majority is, most of the time, is these lobules, which are the glands that produce milk in our breast. And this is basically the major function of the breast in women, is for anatomically and physiologically, it's just basically to produce milk. So for breastfeeding. So these purple lobules that you're seeing here are the glands that produce milk. Then we see these nice ducts that take the milk from the lobule to the nipple during breastfeeding. And the rest of the tissue surrounding these lobules is the fat and the connective tissue. Cancers can begin in either these lobules or in these ducts, and more commonly they occur in these ducts. So this is the major cancers. Where do they occur? Now let's just tackle the issue of how common is breast cancer and why are we so worried about breast cancer. It's something that maybe no one wants to hear about. We're too busy with our lives. We're too busy with our being working mothers maybe, and we just don't want to deal with another obstacle in our life. But to be honest with you, breast cancer has become really the most common cancer globally as of 2021. So breast cancer alone is 12% of all the new annual cancers worldwide, according to the World Health Organization. And the shocking number is that whenever we say it, that 1 in 8 women will develop breast cancer over the course of their lifetime. But we always have to think about the positive. We have to be positive and think that there is 7 in 8 chance that you will never have the disease. But let's think about this one woman who will have breast cancer and how we can catch it early and just get rid of it very early without it affecting her life and her productivity, and just so that we're basically tackle it from the beginning. And for breast cancer, usually the important thing that I need you to know also is that 3 out of 4 women who are diagnosed with breast cancer just don't have a family history. And this is something that I hear a lot, like most women or most patients come to our clinic or to the radiology department and they're reluctant to do their imaging just because they say, I don't have any family history in my close or distant family. Why should I be at risk? I shouldn't be at risk. And I hear it very commonly, like if I don't have family history, then probably I will not have it. This is not true. Just the fact that we have breast tissue, just the fact that you are a woman with breast tissue puts you at risk. Definitely, if you have history of family history, this puts you at a higher risk. But I want you to know that this is not a logical excuse to use. Even if you don't have a family history, you should get checked because breast cancer is becoming more and more common. And as I said, it's one of the most common cancers in 2021. Then we come to the important age group, which is the late 30s and the 40s. And as I said, women in this age are at their peak productivity. Women in this age are still have small children, or they have adults or adolescents, and their family needs them, their kids need them. So look at this number, 1 out of 6 breast cancers occurs in women aged 40 to 49. So basically the misconception that we have in our head that cancer usually comes with older women, with my grandmother or my older aunt, this is not true. We are the women that are being affected by this cancer, and it's the leading cause of cancer death in women over the age of 40. So it's very important to put this number. 40 is the magic number for women. We have to abide by this number, and I will let you know why. So after we're gone over the important numbers about breast cancer and how common it is and the age group that it usually affects, we're going to talk quickly about the signs and symptoms, just so that everyone knows what is abnormal and what is normal. And I always emphasize the fact that patients, they know themselves better than the doctor. whenever a patient comes in, I just tell her that you know yourself, you know how your breast feels and looks, you know how everything looks. You just have to follow your guts, just basically follow your guts. If you feel that something is abnormal, just get checked. And the majority of the signs and symptoms are just benign findings. They are not cancer. If you feel a lump, the probability that it's something benign and it's not cancer is very high. Just don't be afraid of getting checked just because you're afraid that it's cancer. The majority of the time it's a benign finding. And I really, really want to emphasize on this. Just go to your physician, get checked. In case it's benign, you just have the, you'll just be at ease. You know that it's nothing. And if there is the need to do any ultrasound or mammogram, we will do that, and we will just make sure that it is not a malignant or an abnormal process. And if it's a benign process, then you'll just go along with your life and you don't have this worry in your head that I have something and I did not check it. So this is a nice presentation of lemons, and it's a nice application that I have on my phone. It's called Know Your Lemons, and you can just download it, and it tells you, it just takes the time of your period, and it tells you when is the good time to self-breast do a self-breast examination, which I will be talking about later. So basically, we can see a lot of variations in these lemons. This is here a normal lemon, but there's a hidden lump inside it, which will not be evident on a self-breast exam. Even the doctor will not be able to see any abnormality in this lemon. And we go over these, we can see that there's a lot of abnormal shapes. Here, there's a small bump out of this lemon. There's a small indentation here, which is abnormal. The skin here is abnormal. We have sores or we have redness. And most importantly here, for example, we have discharge from the nipple. So I will go over these in details just so that we are aware of what are the common signs and symptoms of breast cancer, and not so common also. The common one is a new lump or a mass. So please, whenever you feel a lump, usually this happens during our daily routine life, during shower, while you're wearing your clothes, you feel there is something maybe abnormal in your breast, then please get it checked. No cancer. Well, okay, are we okay with the connection? Okay, so any new breast mass, lump, or breast change, as I said, get it checked. This is very important. I cannot say it enough. Just go see your physician and make sure that it is checked. The other possible symptoms of breast cancer, I'm going to go over them. Basically, it's any abnormality that you feel is not part of the normal feeling of your breast. So if there's a swelling, even if there's no lump, get it checked. If there is skin dimpling, sometimes it might look like an orange peel, similar to this, or there is breast or nipple pain, also go see your physician, get it checked. It should be part of the things that your physicians go over, and the breast examination is also something your personal physician will be performing like a yearly checkup. Another important finding is nipple retraction. So any change in the shape, the size, or the direction of the nipple is abnormal. If you see that your skin is like in one area red, or it is thickened, or it's abnormal, also get it checked always. Any abnormality in the breast can be an indirect sign of something abnormal in the breast. So let's just not ignore these signs that our body is trying to tell us, and make sure that we go see our physicians. An important also symptom is the nipple discharge. Basically, we see that a lot, and it's important that the discharge is not breast milk. Usually breast milk, especially if women have breastfed in the past, they always feel like there is tiny amounts of milk from the nipple that is being discharged. So the alarming nipple discharge is that of blood, or like rusty colored nipple discharge. An important thing also is not to just focus on the breast. So there are other areas that are related to the breast, and we usually examine during our radiologic studies, which are the underarm and the collarbone. So the collarbone and the underarm are also areas where they can show us indirect signs that there is an abnormality in the breast. So it's also important to always examine these areas. And if you see any lump in these areas, also get it checked with your physician. So this is just like an overview of what are some things that you might encounter, but I want to let you know that examining yourself and allowing your physician to examine you, excuse me, is very important. Then we're going to go over, excuse me. So we're going to go over now the risk and prevention. So this is where some of the things that we might be able to change and will affect our breast cancer risks in the future. So as you know, a risk factor is anything that might increase your chances of cancer. But most importantly, having a risk does not mean that you will get the disease, because I always get patients that are very anxious that the risk factors are high, and I just tell them that you might just live your life and you will not even encounter breast cancer. As long as you're doing your screening exams, then I think you are fine. And we're going to go over the risk factors that are lifestyle related. So these are the kind of risk factors that we can basically change. And I think it's important to know these risk factors, because not only we will have a better lifestyle, but knowing that they will decrease our risk of breast cancer is important. One of them is drinking alcohol, and there's a clear link between breast cancer and increased alcohol intake. And this risk increases with the amount of alcohol that is being consumed. So women who drink about 2 to 3 drinks a day are about 20% higher, have a higher risk than non-drinkers. So let's say that social drinkers do not have a very high risk, but let's keep this in mind, that drinking alcohol is one of the risk factors that we can really avoid. And it's best not to drink, but for women who drink, they usually should have no more than 1 drink a day. That's why I'm saying like social drinking during a weekend maybe might be acceptable and will not increase your risk dramatically for breast cancer. Also, being overweight or obese is another risk factor, especially after menopause. And I will be explaining that. So before women reach menopause, the most important factory in our body for estrogen are the ovaries. So the ovaries are the organs that are producing the estrogen. And the fat tissues have a small role in producing estrogen. So the fat tissue, the normal fat tissue in our breast, have a very small role in producing the estrogen. After menopause, once the ovaries stop making estrogen, if a woman is overweight or obese, what will happen is that her fat cells will start producing this estrogen. And why is estrogen important? Because estrogen is a very important hormone in our body as women, and it is the stimulator of all the breast changes, and it has a very important effect on breast cancer and breast disease. So it's like the fuel, or it is the activator of this disease in the breast. So that's why Estrogen is a very important hormone. And after menopause, usually women are at an older age, they have an increased risk of getting breast cancer. And if they are obese or overweight, this amount of estrogen that is produced by the fat will be affecting the breast and will be probably increasing also the risk of getting breast cancer. But that does not mean if you are overweight or obese that you will get breast cancer. It's very important to understand that I am giving you now a list of risk factors and a list of preventive factors, and it's just multifactorial. It's a multifactorial game, and it depends on how many risks you have, what is the lifestyle that you have before. So it's not like white and black. It's a very gray zone where we have multifactorial. It's multifactorial, and it's not just one risk that will put you at high risk so that you get breast cancer. Another important thing is just being physically active, and there's a lot of evidence that regular activity reduces breast cancer, and let's not say how it will just enhance our life in every aspect, whether it's related to the heart, whether it's related to our mental fitness also. So being just active, being physically active, doing regular exercise is very important, especially in women post-menopause. And it's just that some studies were conducted that women who have even as a couple of hours a week, which is something that we as working women struggle with, this lack of activity and the sedentary lifestyle, maybe behind our offices, we're spending a lot of time. So just make sure that you have some time for yourself, and especially some time where you're doing some activity. And we really don't know how physical activity affects breast cancer as a risk factor, but it might be related to its effect on the body weight, as I said, and on the hormones that our bodies produce. Then we come to the another factor, which is having kids or not having kids. So not having children, women who do not have children are have a slightly higher risk for breast cancer. And what are protective factors are having children, but having your first child before the age of 30. And this is an important protective factor. So these are part of the questions that we ask during our questionnaire when patients, we see them in our clinic. We ask them about if they had children, what was the age that she had her first children. And this is also basically all related to the hormones that we are exposed to during pregnancy and how they will affect our risk for breast cancer. So what will reduce your risk of having breast cancer is having multiple pregnancies and becoming pregnant at early age. And this is because during pregnancy, estrogen, which is the fuel or the hormone that is basically activating all the disease in the breast, is at its lowest level, and there is the hormone progesterone, which is dominating during the pregnancies. So this progesterone and the lack of estrogen during this 9-month period will make you less exposed to estrogen, and then the chance that these cells will become abnormal due to the effect of estrogen is also less. Then we come to the topic of breastfeeding, which is now we're also raising a lot of awareness about it because it really has a lot of good impact on the mother and on the newborn. In addition to that, it lowers the risk of breast cancer, especially if it's done for a period of more than 1 year. And it's also that during breastfeeding, the estrogen level is low, and there are other hormones that dominate, and that's why it lowers the risk of breast cancer. Then we come to certain birth control pills or hormones that we might use during our life as women. One of them is the oral contraceptive or the hormone-releasing intrauterine devices that we use so that women will not get pregnant, for example. This will also put you at a slightly higher risk. But I just want to let you know that if you take these hormones, it does not mean that you will get breast cancer. It is multifactorial. I really want to emphasize on this. It is multifactorial. There are a lot of factors that are being included here. So this is another diagram that shows the how estrogen is basically important, as it's an important risk factor for breast cancer. So early in our early 20s, 30s and 40s, the estrogen is really high. Once we hit menopause, the estrogen decreases. So the activity of this estrogen on our breast decreases, and the risk of these cells becoming abnormally activated and turning into breast cancer is less. So hormone therapy after menopause, it was very commonly used in the past. Every woman that used to hit menopause, we used to start her on hormone replacement therapy. Now we're becoming more conservative about that, just because this also slightly increases the risk of breast cancer. So as a woman, you have to try to decrease these factors. If you don't need hormone replacement therapy after menopause, just don't take it. Always consult your gynecologist or your physician if you really need this hormone replacement therapy after menopause. And these are usually given, if they are given for a short period, just so to prevent like these symptoms that like the hot flushes or the irritability that women feel. So it's a short-term release, these post-menopause hormonal therapy. And they also put you at a slightly increased risk if you are taking them after menopause. Some of the risk factors that we really cannot control, and this is just, we have to accept them, we have to acknowledge these factors. Just being born female and having breast tissue is the main risk factor of breast cancer. Men can get breast cancer too, less common. I will tackle that later, but just being a female is one of the risk factors for breast cancer. How about getting older? We know that cancer is the disease of older age. So one of the risk factors is just growing in age and getting older, especially after the age of 55, where menopause hits. This is another risk factor, but this is something that we cannot change. Another thing that we cannot change is the inheriting certain genes from our parents. And usually this is about 5 to 10% of breast cancers are thought to be hereditary from genes that we just take from our mothers, from our father. And these are gene mutations or gene changes that are passed from a parent and are directly putting us at an increased risk of breast cancer. I don't know if you have heard about these two gene mutations. They became heard of because Angelina Jolie had one of these mutations and she had to do a double mastectomy. She had to remove her breast just because she had these mutations. And these are called the BRCA1 and the BRCA2 gene mutations. And this really puts you at a higher risk of breast cancer. These genes, in brief, what they do is that they repair any damaged DNA or cells. So whenever we have a mutation in these genes, what will happen is the repair is not going to happen. So if any abnormality happens, it's just going to go unnoticed, and the abnormal cells will grow and they will lead to cancer. The patients that have these kind of genetic mutations will have approximately 7 in 10 chance of getting breast cancer by the age of 80. So these are women that are in a different category from the general population. These are women who have abnormality in their genes that are really putting them at a very high risk for breast cancer. And this is why women with one of these mutations are usually diagnosed with breast cancer at a younger age. An example is, as I said, Angelina Jolie, and they have cancer in both breasts. So they are basically at a very high risk of developing breast cancer. And prophylactically, to prevent this, since they are at a high risk, women with these mutations just totally remove their breast tissue, all of the breast tissue, to lower their risk of getting breast cancer. Having a personal history of breast cancer is also a risk factor that you cannot change. So for example, if a woman in her 40s, she had breast cancer, the possibility or the risk is higher for her to have cancer in another place in her breast or in the different breast. Another thing that we cannot change is the race and ethnicity, and there are some races that are at a higher risk, like white women are slightly more likely to develop breast cancer than African American women. But for African American women, usually they have breast cancer less than 45, which is a very young age. So 40s is a young age for women to develop breast cancer, and they are more likely to die from breast cancer. So African-American women, they are like a different category where they are considered high risk, especially if they are young. And for example, other ethnicities such like Asian, Hispanic, and Native American women have a lower risk of developing and dying from breast cancers. And this all goes back to the genes that we get from our ancestors. One thing that I'd like to discuss, and it's one of the factors that we cannot change, it's basically how dense the breast tissue is in the breast. So as I said, as I started my presentation, the breast is composed of the normal glands that produce the milk, the ducts, and the fat surrounding them. So the more we have tissue, or the more we have these normal glands that produce the milk, and this is something genetic, we take it from our parents, the slightly higher risk that we have to developing breast cancer. So women with dense breasts have a risk of breast cancer that is about 1.5 to 2 times that of women with a less dense breast. And this is also something that we cannot change. This is something genetic that we have to accept. Then we come to the menstrual periods and how they affect our risk factors. So basically, the earlier we get our menstrual period and the later we get menopause, this means that we are at a slightly higher risk for breast cancer, just because it means that we have a longer period. So if at a very early age I get my menstrual period and at a very late age I get menopause, it means that I have been exposed for a longer time for the hormone estrogen. And estrogen, as I said, is the fuel, or is the hormone that is responsible for the activation of these abnormal cells in the breast that will later become cancer. Okay, so after we have gone through the risks that we can change, definitely I encourage everyone. As I said, as working women and working mothers, maybe we will not have time to change the fact that we are women, and this is just a risk factor for breast cancer. But what I think we can change is, for example, the lifestyle that we're leading, just having a healthy lifestyle, being more active, eating healthy. This will also reflect on all our life, and especially, most importantly, which is related to our talk, will decrease your risk of breast cancer. Then I would like to go over the common myths and misconceptions that I hear a lot, and basically women believe these myths, and I just want to go over the most common ones, and let's just replace them with facts, because as I said, once patients and women are aware of the facts and they are knowledgeable that there is evidence and science behind the things that we are informing them, then they will become empowered, and they will help us during this journey of becoming aware of breast cancer and coming and getting checked early. This can be a myth versus a fact, that breast cancer only happens to middle-aged or older women. And this is a very common myth, that young women in their 30s, women in their 40s, they're like, why should I get checked now? This is a cancer for our aunts, for our grandparents, and it's not a cancer that will affect me as a young woman. And this is a myth. The fact is, younger women can and do get breast cancer. And I don't want to show you the negative side of our practice, but basically we really see women sometimes in their 20s and in their 30s that have breast cancer, some of which have a very high risk, and that's why they get cancers in their early 30s. And some of them really do not have any family history of breast cancer, and they are not in the age that is included in the screening. So that's why these women who have breast cancer at a very young age usually present at a later stage from the disease, where the stage is more advanced and things become more complicated. But keep in mind that any symptom or sign that you feel in your breast, whatever the age you have, just come, get it checked, make sure it's benign, and then just continue with your life. How about men? Men are also involved with breast cancer. And just so that we're really not discriminating here, it's not just, this is not just for women. Breast cancer can occur in men. It's just that after puberty, women, their breast develops and becomes mature, and male breasts, they do not develop, but they have the rudimentary or the basic cells that are found in our breast. Males also have them, although it is less common. So this is a nice diagram that shows that 1 in 8 women will be diagnosed with breast cancer. However, 1 in 1,000 men will be diagnosed with breast cancer. But it is there, and it's important to know, and our men should know that if they feel any lump in their chest, just get it checked. It might be nothing, but why not get it checked and make sure that everything is normal and it's not cancer. So this is not just an awareness campaign for women, although we are the majority that are targeted in this campaign, but let's just know that breast cancer can affect any one of us, irrelevant of age, status, race, or gender. So women also get surprised when we're in the breast unit and they see a man getting a mammogram. Mammograms are not just for women. So if a man has a lump and we need it to be assessed, just because they have breast tissue, and if they have a lump, we can definitely do a mammogram for them. And this is something basically, if it's a busy breast unit, we do like one man per month, versus the majority are women. 1 to 2 men per month we see who have symptoms and they might have a lump that needs to be checked. How about women who have breast implants? So this is a very common question that I get. I have breast implants and I don't want them to rupture, and that's why I'm not going to be doing a mammogram. I've heard that it's going to be very painful and my implants will rupture. And this is not true. This is a myth. This is, as I said, implants can rupture during a mammogram. This is a mammogram, and you can see these 2 white structures here are the implants. Mammograms can be done for women who have implants. We do it all the time. We see a lot of patients with implants, and we do a regular mammogram for them. Just to rest assured that the manufacturers of these breast implants have really tested the durability of their products, and they apply much more pressure on these implants, much more than the pressure that we apply during a mammogram. So just rest assured, an implant, it will not rupture, and it can withstand the pressure that is applied during a regular mammogram. And I just want to know that women with implants are at a slight disadvantage, because the implant by itself can be covering some of the tissue that might have cancer in them. So that's why I would really encourage them to come do their mammogram, let the breast imaging specialist or the breast imaging radiologist check their imaging, and make sure if they want more tests to be done. So let's consider women with breast implants to be part of the regular population who can get mammograms. It's not for, it will not rupture. And on the contrary, mammograms can even detect abnormalities in the rupture, not only the mammogram. If we do also an additional ultrasound, we can detect abnormalities in the rupture, and we can assess the integrity of the implant. So it's important to get checked, even if you have implants. Another thing that I get asked about a lot is about the antiperspirants and the chemicals in these antiperspirants. So there is I don't know, I have like the chemicals in them, they say they get absorbed in your skin from the underarms, and what they do is that they build up in the breast and they will lead to breast cancer. So this is a myth, and there is no evidence. So basically, as physicians, we try as much as we can to follow evidence-based medicine, not just myth or rumors that are out there. And we see if there's an evidence or there is a scientific reason behind these allegations that people use. So there's no evidence about the chemicals and the antiperspirants that increase the risk of breast cancer. But I just want to let you know that we are now living in an era where we are using a lot of creams, a lot of new shampoos, and all of these, they have chemicals. And I'm sure on the long run, there might be some chemicals in them that might be affecting us on the long run. But till now, there is no evidence that these creams or the antiperspirants or the deodorants or the perfumes that we are using are at least increasing the risk of breast cancer. Another thing that I hear from patients is that the bras or the wires in the bras, because of the pressure that they make on the skin, they might be obstructing the lymphatic drainage. And this will eventually lead also to buildup of toxins in our breast and will lead to breast cancer. And this is just, there's no good scientific or clinical basis behind it. There was even a study performed in 2014 where 1,500 women found no association between wearing a bra and breast cancer risk. And believe me, this is a very common misconception. I hear it very commonly from women, like, if I don't wear a bra, will this decrease the risk of breast cancer? How about mammogram and the level of radiation that we're getting exposed? And this is one of the excuses that women use for not getting a mammogram and also refusing to get a mammogram. Well, as you know, during mammogram, there is a small level of radiation that is being used, but it is not a high or unsafe level. The small amount of radiation is within the medical guidelines. And it's important to know where you're doing your mammogram as well as who is reading your mammogram. It's important that the mammogram machines are always checked for if they are following the guidelines and if the radiation from these machines is within the limits that are being accepted. And I just want to let everyone know that there is natural radiations everywhere around us. There is radiation from the rocks, from the soil around us, from the cosmic rays, from the plants. So there is a small amount of radiation that everyone is being exposed just for being there, for existing, just by existing. We are being exposed to radiation from around us. And the radiation dose from one mammogram is equal to 2 months of background radiation, which is the normal background radiation we are all exposed to. So you can imagine how small is this amount of radiation that you are receiving during a yearly mammogram. So it's not a big dose, it's during a year, and it is basically similar. I always give this example. If you go across across the Atlantic and you take a flight, the amount of radiation that you will be exposed during that flight is similar to the amount of radiation you are exposed during a yearly mammogram. But the difference is that the radiation that you are being exposed during the mammogram might save your life. Then, after I've covered some of the common myths and misconceptions, and if you have if you have a question about one of these misconceptions, I'll be more than happy to tackle it and to see if there is any scientific or clinical evidence behind it. So after we've gone through the risks, the signs, the symptoms, some of the myths, what is the most important thing now is to just detect this breast cancer early, diagnose it early, get rid of it, and continue with our life. How can we do that? Basically, there are several things that we can do. Either it's a self-breast examination or getting a clinical breast examination by a physician and doing the regular screening exams, which is the mammogram. And I'll be tackling about the importance of ultrasound and MRI, which are other modalities we can use in detecting breast cancer early. Early detection of breast cancer is what we are really obsessed about. This is what I want to catch a cancer at a very early stage. I really do not want women to come present with a lump which has been there just because she didn't get her regular screening exams. A clinical breast exam is an exam that is done by healthcare professional. It can be done by your gynecologist, by your GP physician, who's just doing this exam and will detect any abnormalities, will see any warning signs, and will basically refer these patients to us. A self-breast exam is something you do, and you can do it every month at home. Let's go through the quick steps of a self-breast exam. Basically, it should be done during a specific period of the month, after your menstrual period, not before the menstrual period, just so that your breasts are not tender or engorged, and they will affect this examination. So I prefer if it's usually done after the first week from the menstrual period, let's say from day 6 till 14 after the menstrual period. This is the time where the breast or the estrogen hormone is the least affecting our breasts, and this is the time where we can really just examine our breasts rather than them to be engorged, for example, which will affect my examination. And as I always say, patients know themselves, they know their breasts, they know how their breasts feel. So I always really, if a patient comes with a breast lump, I just try to go over it, let her show me the lump, we examine it together, and we go over it with the ultrasound, for example, to make sure that there is nothing there, because I tend to believe patients that they know their body more than their doctors. So as a first step, it would be good to look at your breast in the mirror with your shoulders straight and your arms on your hip. And what we have to look at is symmetricity. We have to look, they have the usual shape, size, and color, evenly shaped without any visual distortion, swelling, changes in the skin, changes in the nipple shape or size. And if you see any of these abnormalities, always get checked, get it to your doctor's attention, especially if you have like skin dimpling, which means as if there's something that is pushing the skin inward, or there is some kind of bulging of the skin that is abnormal. The nipple is a very important part of the self-breast examination. It's important to have it symmetric, whether it is, and to see whether it's pushed inward or outward, if there is any redness, soreness, rash, swelling, just everything that you see abnormal, get it checked. We can repeat the same things with our arms raised and look for the same changes. And at the end of the exam, we can do is that we can squeeze the nipple and see if there's any signs of fluid coming out of the nipple. And the alarming or the red flag for a nipple discharge is that of blood or rusty nipple discharge. We can also do the same thing where we are lying down with our hand above our head. We use the contralateral arm to examine the breast. So if you're examining your right breast, you use your left hand. We do it in a circular motion. We try to cover the whole breast, whether we start from the nipple outwards, we can go up and down, right and left. Just make sure that you cover the whole breast, and also you cover your collarbone, your armpit, and your cleavage area to make sure there are no masses. Some women also prefer to do it while they are in the shower, because the skin becomes more slippery and becomes easier for us to catch these abnormal lumps or abnormalities while we are doing the self-breast exam. So women should be familiar with their breast, how they normally look and feel, and any change, just report it to your physician. So after I've gone through that, I just want to go over what is a screening test. So a screening test that we're doing is just to determine breast, to find cancer before you are even aware of it, before you feel it, before any of these changes I'm talking about the self-breast exam, before you feel anything on your breast. Women can have breast cancer sitting inside their breast before any sign or symptom is out. And some women come and they have a mammogram, and I tell them that I see something very tiny. We need to do further workup for this abnormalities I see. And the first thing that I hear from women is that, but I feel fine, I'm healthy, I don't feel anything, why should I do a biopsy? And this is the important thing that I want to tell you. You are coming for a screening test because you are healthy. You are coming for a screening test for us, for your for the breast imaging specialist to find this cancer when it's really tiny, when it's few millimeters big, just so that we can remove it and do the appropriate workup for it before you have any symptoms. And this is what I want to emphasize on. Screening test is when you do not have any symptoms, and early detection means finding and diagnosing a disease earlier before you have any symptoms. So it makes the treatment much easier, and the outlook for the woman, for the prognosis, which means predicting the outlook of this disease, also more favorable for these patients. So we really want to catch cancers when they are still confined to the breast, when they are really tiny. We aim to catch these cancers when they are less than 1 centimeter. If we are lucky, we can catch them when they are still few millimeters big. And you cannot imagine how easy the journey after that. It's going to be basically a very small surgery. Sometimes there are new treatment strategies like hormonal treatment that just control this disease without having to go through the what we know about breast cancer, and that there might be chemotherapy, and it's a very tough journey. So this is not the case. This is not the case. What we're trying to do is to catch it early and treat it early, and for a woman just to go ahead with her life, with her ambitions, and be next to her family. Briefly, I'm going to go over what are the screening recommendations for average breast cancer risk women, which is basically the majority of the population, is when you don't have a family history of breast cancer, a personal history, and you don't have a family history, and you don't have a genetic mutation. So basically, you're one of the average women in the population who are just at risk of breast cancer just because they are women, as I said. So the magic number is 40, and usually we should start doing a mammogram at 40 every year until we reach basically the age of 74, 75. At that age, we assess how preserved is our patient. If she's in good health, then she can continue doing them every year. A mammogram, as I said, as I described previously, there's some X-ray that is involved. We have a very small amount of radiation that is similar to the background radiation that we have. And it has been shown through a lot of studies on a large amount of women that is the only test to detect breast cancer and to reduce the cancer death by 40%. So by detecting cancer early, we are reducing the death from breast cancer by 40%. And we are improving the odds of survival of women at and just avoiding extensive treatment. This is a diagram of what is a mammogram. What will happen during a mammogram is that you will be presenting to the radiology department, specifically to the breast unit. A female technician will be welcoming you, helping you during this exam. It definitely, as you can see, the breast is squeezed between two paddles, but please, this is not a painful procedure. There is discomfort, but it's a short period of time, for a couple of seconds. The image is taken, then the paddles are released, and basically it's just going to take like 10 minutes. The whole procedure is 10 minutes. The squeezing is basically for a few seconds, and it's going to be saving your life. This is an example of a mammogram. We have to take 4 views. The basic imaging of every woman is 4 views. So every breast will have 2 views. One from the paddles will be squeezing on from up, and the other image is the paddles are squeezing from the side. The new technology that we have with the mammography machines are there will be less radiation to women, and we have what we call the 3D mammogram. So the nice thing about this is that the X-ray, the machine, while it's taking the X-ray, it will move, and then we will have slices of the breast, similar to this diagram, slices of the breast that are having X-rays being taken. What is important about a mammogram? The first time you do a mammogram, the radiologist should tell you about your breast density. As I said, breast density is the amount of tissue we have in our breast. The yellow is the fat, the pink is the tissue. The more tissue you have, the more dense you are. And unfortunately, with more dense tissue, it means that you are at a slightly increased risk of getting breast cancer. And your mammogram becomes harder to analyze, just because these tissue have the ability to make some masses hide between them. This is an example of a mammogram, and I'm going to go over it with you. The mammogram that is seen on this side shows that there's a lot of white in it, in contrary to this mammogram that has a lot of black on it. So black means you have more fat in your breast, and this is an X-ray of the breast showing more fat, which is black. And on this side, we have a mammogram of a woman who has a lot of tissue in her breast, and it is white. So you can see if you have a cancer, which is also white, or any other abnormality, which is white, what will happen, it will become hidden when we have more tissue that are white. That's why women with increased breast density are slightly at a disadvantage when it comes to mammogram, but do not worry, we have other modalities that will help us to detect the cancer. We can add, for example, an ultrasound, which will help us to detect cancers. We usually do a mammogram during a specific time of the period, right after like day 5, 6, after the first day of the period until day 14. As I said, this is the time where your breasts are least engorged, least painful, and the exam will be easier on you during that time. And make sure you do not apply deodorant because it might cause some abnormalities on the mammogram that we do not want to see. How about breast ultrasound? It is a complementary imaging modality to the mammogram. It is not the mainstay that we use for detecting breast cancers. This is another misconception women have. They think if they have ultrasound that they are safe, and we say it's normal, then we are safe. There's no breast cancer. No, this is not true. A breast ultrasound is usually done for women over 40 if they have dense breasts as a complementary study and not as the only study, because mammogram is the gold standard for detecting breast cancer. I'm sure you heard about breast MRI. So in breast MRI is also another modality we can use for patients to detect breast cancer, but this is not a modality that we use for all average risk women. We use it for women who are at an increased risk, and basically not all women are encouraged to do breast MRI. The only screening test that I encourage you to do is a mammogram. The mammogram is the study that is being approved by all guidelines worldwide. That is the only study that will decrease your chance of dying from breast cancer by 40%. So this is the take-home message that I want you to if you just get one message for today, is that the only person who is going to take care of you is you. The only person who's going to save you is you. We as women, as I said, working mothers, busy, we have reached a stage where life has become really hectic and we don't have time to take care of ourselves. So we have to take care of ourselves mentally, psychologically, and even of our health, so that we can continue to be role models to others, to role models to our kids, so that we can continue to be available for our parents, for our kids, for our career. And basically, the best protection is just early detection. We are all at risk. Let's just be smarter than cancer. Let's just do our screening exams. If there's cancer, I will catch it early. If there's no cancer, I will continue with my life. And even if there's cancer, no, breast cancer is now a very treatable disease. Breast cancer will not kill you. And the chance of living if you have breast cancer, if it is caught very early, reaches up to 97%. So the message is that breast cancer is not a killer anymore if we catch it really early. Thank you for your attention. I really hope it was to tackle the things that you might think is important. And if you think there's anything that you need more clarification about, I'm more than happy to answer these questions. This is my email, and you can just contact me, whether on LinkedIn, on Instagram, on social media, personal email. I'll be more than happy to go over the questions or the concerns that you might have. These are some of the resources that I have used, and if you have a copy of this slide, you can go over them. There are some nice resources for patients who are worried or have concerns about breast cancer. In brief, mammography really saves your lives, and one of them can be yours. Thank you.
Thank you so much, Dr. Tatiana, for all this valuable information. I see that you've put in a lot of very, very valuable information in such a short period of time. Again, as Dr. Tatiana said, if you'd like to reach out, her details are found in the chat box. You can also view the presentation. We will show you in the chat box where you can do that. There are 2 questions. I believe you've answered one, Dr. Tatiana. One of them, I think, was answered, which is, can you please tell us when is the best time to do self-examination? And you've mentioned it is between day 5 and 6 of the period. After day 5 and 6 until day 14 of the menstrual cycle, correct?
Yes, the first week after your menstrual cycle. So the menstrual cycle starts with the first day of bleeding. Let's just count from the first day, 5 to 6 days. After that, that would be the best time to do your self-breast examination. And it's important to know that if you do your self-breast exam, this is not an alternative to the screening, to mammogram. It's not an alternative to getting checked by your physician. It's something that we encourage to do so that you can catch a lump, but you should always check with your physician, and you should be doing your screening test if you are 40 and above.
100%. Another question posted was, what about Middle Eastern ethnicity? Does it have a higher or lower problem of breast cancer?
Unfortunately, it has a higher. We, as in the Middle East, we have a higher risk. This is genetic from our ancestors. I come, for example, from Lebanon. I have worked there as a breast imaging specialist for 3 years, and we were seeing a lot of cases of breast cancer just because this is part of our ethnicity and of our genes that we have inherited from our ancestors. So unfortunately, yes, in the Middle East, we are at a higher risk of breast cancer, and basically we're seeing more breast cancer at a younger age. That's why I encourage women, we are recommending women between 35 and 40 to get 1 mammogram between 35 and 40 as a baseline, just because we're seeing cancers that are becoming common in the late 30s.
Agreed. And as you said earlier, the best protection is early detection. Definitely with you on the point about mammograms. They are definitely discomfortable, but they're not painful. So from somebody who does not skip my screening on a yearly basis, I can vouch and say that yes, it's true. They are not painful. They're just a little bit discomfortable for a couple of seconds, as you said. And now, all thanks to the new technology that's available, it's really not a big deal. And I'm sure, exactly. So I see there are no further questions, Dr. Tatiana. Thank you so much for your time. And it really means a lot to us. For the audience who joined us today, thank you for tuning in. Please share the presentation, spread the word, and help everybody around you try to get more and more access to this information and to demystifying all the false misconceptions around this topic. Thank you so much. And I wish everybody a great day and a lovely weekend ahead. Thank you, Dr. Tatiana.
Thank you. Have a good weekend.
Thank you.